Okay, so it's Lori, Andy, Catherine. Okay, showtime. Whoops. Hello, hello, hello. Can we have the microphone on? The microphone's on. Sorry. So as people are filtering towards their seats, I hope everybody can get settled. I think that the second session today is really critical for all of you with children who are going to grow up and you care about their future. It's the job of all parents is to care about the future for their children. And I think that's really what we're addressing here this afternoon. So there are a number of people who are here in the audience today that I'd like to point out to you so that at the end of the session, if you'd like to go up to them and speak with them individually, because they bring their own expertise and experience with Kawasaki disease to the group, and we're delighted to have them all here today. So I want to introduce the people who are going to be speaking because you're going to meet them. But Dr. Mimi Glaudet here in the front. Mimi, if you could stand up so people can see you. Long-term Kawasaki disease researcher, the person with whom I started my career in Kawasaki disease at the University of Colorado in Denver. Dr. Glaudet is an infectious disease specialist and head of infectious disease there. So thank you, Mimi, for coming. Dr. Bill Mason from LA Children's Hospital, also of the same generation of Kawasaki disease researchers. Yeah, it's called old. No, we say original. We're the original American Kawasaki disease researchers. And Dr. John Gordon in the back. Dr. Gordon, if you could stand up so people can identify you. Dr. Gordon is at the San Diego Cardiac Center. He's an interventional cardiologist and has the distinction of following as a single person more adults with a history of Kawasaki disease than any other single cardiologist in the United States and perhaps in the world. So Dr. Gordon, a very important part of our clinical team, and some of you may want to talk with him at the break. Other people, Leslie Giesman. Leslie, are you here? There she is, in the back. Dr. Giesman is a trauma surgeon, but also a Kawasaki disease survivor. She was a missed Kawasaki disease and presented with her heart attack. She's obviously doing well and would be happy to talk with a number of you who have concerns about your children, or for the other adults here who similarly have had heart problems after Kawasaki disease. Leslie would be happy to talk with you. Other people I wanted to introduce, Mr. Rupert McNee up here in the front is responsible for a lot of the videos that you've seen and over the years has put together the Race for the Answer at the KD Foundation, the video that we have there. He's the distinguished voice in the heart animation that's on YouTube, part of which you saw with Jeff Frazier, but you can go to YouTube and actually hear Rupert. So we're delighted to have Rupert with us today, documenting a lot of the event. Dr. Mike Takahashi. Mike, are you here? Mike's, I think, outside, but longtime pediatric cardiologist, was there at the beginning of Kawasaki disease research in the United States, is at LA Children's Hospital, and I think he's somewhat emeritus now, but still very involved with Kawasaki disease. Greg Chin. Greg, where are you? Do you want to come up for a second, Greg, and just say a word about the events tonight? Greg Chin is the president of the KD Foundation, so he's the guy that you get to when you go to kd.org. And Catherine Frank, who is the major organizer for this symposium. Catherine, are you here?
Catherine's just outside.
Catherine's outside, organizing something, no doubt. But huge thanks to her and to Greg. So the KD Foundation are the sponsors of this. This costs money to rent this hall, to have the refreshments, and we're very, very grateful to the KD Foundation for being our sponsors. And I'm going to let Greg say a couple of words to you here.
All right. Thank you, everyone, for coming out today. I'm a parent of a child at KD as well, so I know kind of what we're all going through. I know we all go through different experiences, but events like this are really important to help us understand what we're going through and to meet other families, because I know that when you're going through this for the first time, you feel quite alone. So hopefully you're finding not just some good information that's being presented here, but also getting to meet some other families. The event that Jane was referring to tonight is a fundraiser, and I think from the research that's been presented here, you can see that a tremendous amount of work is being done here at UCSD, and it's all very promising, and we hope it will yield answers down the road. And a lot of people don't know, though, that this work that's done here at UCSD is leading. I mean, the team here is internationally renowned, collaborating with researchers all over the world, and they are at the forefront. A lot of people don't know that they do this on a shoestring budget. I think they probably spend as much time doing grant writing, maybe more, than they're actually doing research. And tonight's event is to help raise money for an endowed research chair at UCSD so that Jane and her team can focus on research, which is what they were put here to do, and they're so passionate about it. And so if we can help them, they can help all of us. So tonight we have an event, and it's at La Costa, and we know that the main purpose of that has been to raise money, and I know that the ticket prices are pretty high. That's the purpose, but we also want it to be very inclusive. And so for those of you that were considering going, we do have some openings, and if you're interested in coming, we do have discounted tickets, and we just really want as many people to come as possible. So at the break, we have a table, and if you're interested in coming, just come to see us, and hopefully we can get as many people there as possible. And just a little bit about the foundation. We are all parent-run organization. We're all, I should say, not all parents. We do have one of our board members actually had KD as a teenager, and she's a young adult now. And so we have quite a range of members in participation in the organization. We also manage a global network of support volunteers. So parents like us who are going through this for the first time contact us, and we try and connect them with families in their area and perhaps in their native language or in their country to help answer questions that may have. So we're all here in this together, and we're just looking for collaboration and support, and we look forward to working with everyone in the group, and appreciate you coming out. Thank you.
We all owe the KD Foundation and Greg a huge, huge thank you for this. So to move on with our program this morning, I'd like to introduce Dr. Lori Daniels from UCSD Cardiology, and she's going to begin the discussion about the studies that we're going to be doing on adults who had KD in childhood and how we're going to get the important answers to the questions that you have. Please welcome Lori Daniels.
Once we unlock our computer. Thanks. Well, welcome everyone. I'm very honored to be able to speak to you today about this really important topic. What we're trying to establish here is something that we've named the San Diego Adult KD Collaborative. And there were a lot of great questions asked at the end of the last session about what the future holds for our KD children. The purpose of this Adult KD Collaborative is to try to get some more answers so that when these questions are asked, we don't have to say, I don't know, I don't know, I don't know. So I'm going to go over what the Adult KD Collaborative is, focusing mostly on what we're going to be doing and trying to learn, not as much on what we already know. I know there are a lot of questions out there about what the future holds for our kids. Some of that we can address at the question and answer session. There's also an article out on the tables summarizing the latest in our research knowledge that you can pick up as well. But I will try to answer some of that. What I'm going to speak with you today about is the goals of the study. What are the components of the study that we may ask your children or you to go through, and what we hope to learn. This is what we want to try to avoid. Right now, even doctors don't necessarily know a lot about what the future holds for our children. we need to change that. So the overall goals of the study are to find out what does the future hold for individuals who've had Kawasaki disease. When you think about it, as we learned the timeline, the first case of KD that Dr. Kawasaki saw, he told us, was 1961, and he first described it in around 67, and in the United States it wasn't until 74. So the oldest these described cases could have been now are just about in their mid-30s. And so really we don't have a lot of information about what happens to individuals with Kawasaki disease beyond that age, because it's only now is it that these children are starting to grow up. How will having had Kawasaki disease affect our future cardiovascular health? Is there a pointer somewhere I saw? Okay, thank you. Pardon me. What is the risk for individuals who were told they had normal echocardiograms, who did have normal echocardiograms during the acute illness? Is there any risk for these individuals? Is there anything we need to worry about? And can we predict who may be at risk in the future using some simple, safe, non-invasive tests? These are the things we hope to answer. Why are we even asking this? Well, it has come to our attention over the past few years that some individuals who perhaps thought that they were fine after Kawasaki disease have presented down the line with some heart complications. Now, it's important to understand that we believe this is the exception and not the rule, okay? We do believe that most people who, if they've had aneurysms, they've regressed, or if they never had aneurysms, are probably going to be fine. But there are a few individuals where problems have ensued, and we believe that it is better to be safe than sorry and that we need more information. And by learning this, we will know what to expect and what to tell our patients. So how are we going to get this information? Number one, our goal is to create a database of young individuals and young adults now who had a history of Kawasaki disease. We plan to follow these individuals long term so that we can chart and analyze exactly what happens. And we're going to ask detailed questions, as was briefly talked about before, not just about the Kawasaki disease history, but about other medical histories, so that we can potentially pick up associations with other diseases, with arthritis, with celiac disease. If there is an association to be found, we hope to find it. Number two, we have a goal to use some standard and novel blood tests that can help us predict cardiovascular risk. Wouldn't it be great if we could do a simple blood test on a teenager or a young adult and say, your risk of future heart problems is very, very low, or conversely, you might be at higher risk. Why don't you stay in contact with your heart doctor more frequently and get these tests? Number three, and Dr. Kahn is going to talk about this a little bit more after I'm done, imaging tests. We have some powerful imaging tools that we can use to actually take excellent pictures of the heart and help us assess risk. And number four, there's some tests of the function of the blood vessels that we can do to help assess risk. These are things that look kind of like a blood pressure cuff that I'll talk about in a few slides. I'll show you a picture. But by inflating a blood pressure cuff, deflating it, and then taking measurements, we can tell how well the blood vessels are working. And we have some reason to believe that this will help us predict risk, since Kawasaki disease is an inflammation of the blood vessels. We'll be able to see how well those are working. So there's a lot of components to this study, and this is just a list of them, that if you or your children sign up to join us, we will invite you to participate in. And you don't have to do all of them. We hope that you will, but you can choose and do some or all. And it includes the questionnaire that I mentioned. We'll be getting an EKG, an ECG on everyone, a history and physical examination from a cardiologist. I told you about the blood test. We're going to get some blood so that we can try out these new markers, these new blood tests, and see if they're helpful. An echocardiogram, as all have already had. We'll be doing follow-up echocardiograms. Potentially some specialized exercise tests, MRIs, coronary artery calcium scores. That's similar to what you may hear ads for on TV or the radio to get a heart scan. I told you about the blood vessel function testing and some measurements of the peripheral arteries and the carotid arteries, as well as long-term follow-up. We will contact you every year or two and say, hey, how's everything going? Anything new we should know about? And that's how we're going to get all of our data. Who are we going to study? Well, there's three groups of individuals that we're going to study. One is the most obvious, young adults who have a childhood history of Kawasaki disease. Once you turn 16, you'll be eligible to participate in this study. Also, individuals with a history of KD who weren't necessarily in our database from their initial illness, but they hear about us on the internet or some other way, and they want to join the study now. Perhaps they've had heart problems and they contact us. We will let them join the study as a second component. And then number 3, we will be asking many of you to potentially refer a healthy friend. This will serve as a control group, because anytime we find a test, you want to be able to compare the results from our Kawasaki individuals with a healthy age-matched group. If you are able to refer a friend to us, that will give us a good control, someone to compare data with. So these are safe tests, so we'll be doing them on them as well if they agree. So how many visits will you need for the study? Well, at one visit, you'll speak with one of our physicians. It could be me, it could be Dr. Gordon. We'll take a history, an exam, things that we recommend you get as part of routine follow-up anyway. At that time, if you're interested, we'll give you the questionnaire and you can get the blood drawn. There will be another visit where you can get an ultrasound, the echocardiogram of the heart, and the ultrasound of the carotid and peripheral arteries. Often those can be done together. And then if you're interested in the imaging portion of the study, there may be a visit for the MRI and or the coronary artery calcium score. And there's a separate visit if you're interested in having this non-invasive testing of the blood vessel function. So this is just a diagram to kind of show the flow of visits. You'll have, if you're interested, you'll have a doctor visit where we do the standard components, some imaging visits, the blood vessel function visit, and then follow up either by phone call, mailer, or in this day and age, email potentially every 1 to 2 years, and or clinic visits. Now, of course, if we're serving as your doctor or if you have your own cardiologist back home, any standard clinical follow-up would be in addition to this. Your doctor may want to see you every 3 to 5 years or more frequently if there's other issues going on. So just to give you a better idea of what some of these tests include, an electrocardiogram is a standard procedure where you put electrodes with sticky tape on the chest and you can get a picture of the heart rhythm and some understanding of the underlying function of the heart. An echocardiogram is something we're also probably all familiar with. It's a non-invasive test that uses sound waves to take pictures of the heart, and we get very good pictures of the muscles, the heart valves. We can tell a lot about flow. Some folks have asked about studying for fibrosis. We believe to some degree we'll be able to discern that with these echocardiograms as well. A carotid artery measurement, like an echocardiogram, also uses sound waves and is non-invasive with no radiation. You measure the arteries in the neck, and then you can see how thick the walls are. And we believe that measurement might help us. The peripheral blood vessel testing, for one component of that is to measure the blood pressures in the arms and in the legs and compare the two. And that's as simple as having a blood pressure cuff on both and simply taking blood pressure measurements. Also not painful, not harmful, but we may be able to get some good information. And then here's someone you might recognize getting the blood vessel test that we're actually going to be doing. Now, this is not our office, but I couldn't resist the picture to show that even Whoopi Goldberg can tolerate this test. Basically, what this involves is a blood pressure cuff on the arm that we inflate, and we keep it inflated for about 5 minutes. So that part can be a little bit uncomfortable, but usually not painful. Then when you release the blood pressure cuff, you can measure the flow down the arm. And that's by using a simple finger probe that just clips on your finger. And that's what Whoopi Goldberg has on her fingers here. And then a computer measures the blood flow and can give some sense if the flow the restoration of flow is normal or abnormal. So that's another component that we will be offering. Here's an example of a cardiac MRI machine, which I'm not going to talk about because Dr. Kahn will, and coronary artery calcium scoring in a CAT scan. You can get some sense of aneurysms potentially and the amount of calcium in the coronary arteries. And then, of course, we'll have clinical follow-up, as I mentioned. So how often will we contact individuals after the initial visit? As I said, every 1 to 2 years we'll be calling to get follow-up. Of course, if new health issues arise, you'll always be free to let us know proactively, and clinic follow-up visits will also be scheduled as needed. So in summary, I think that this provides us a very important opportunity to collaborate with pediatricians, internists, heart doctors, all the different doctors getting together to finally get some answers here on what the future may hold. It's going to provide very important information, not just for parents, but for doctors who have to care for these people so that doctors will know what to do. We've got an interface with the American Heart Association, who we're going to hear from as one of our speakers here, and also the National Committee that writes guidelines for doctors. And it's going to utilize new approaches to answer these important questions. What will we learn? Well, I think here's a short list of what we hope to learn. Number one, what are the long-term heart risks? Do we know what they are? We know some of them, but we may not know all of them. How likely are these risks? Certainly, the risk is different in different children. Some will be at higher risk than others, and it will be important to know exactly how likely it is for each individual person. It'll help us find out who is most at risk, and are there other long-term health consequences besides heart problems late after KD that we may not know about. Now, questions were asked previously about implications for future pregnancies and male fertility as well, and I just wanted to make one comment about that. Although it's been stated that women or girls who have large aneurysms may have some issues with pregnancy down the line, I did want to reassure people that every patient, every person has to be looked at on an individual basis, and there is good data in the medical literature of children who have had Kawasaki disease, even with aneurysms, who go on to have normal, healthy pregnancies. So I don't think there's any absolute contraindication to pregnancy for kids who have had Kawasaki disease. I know that may be a question some of you have had. But with this study, we'll at least be able to get some good numbers and be able to quantify what risk, if any, there is, and maybe even learn how best to deal with that risk. A lot of issues like that are likely to arise during the course of the study, and that hopefully we'll be able to get answers for. And of course, the ultimate goal is to learn how can we decrease this risk. Not just find the risk, but deal with it, catch it early, and prevent long-term problems. That's the true goal. Ultimately, that will lead to recommendations that we can disseminate to other doctors on how to follow up our patients with KD. Thank you very much for your attention, and I'll be happy to answer questions later.